I'll show you the umbilical cord. It's a very simple slide, and but in between I will show you a fetus with the umbilical cord and placenta. I'll show you there, and then you see the slides, you correlate, and in between I tell you, because it's a cord and the umbilical cord connects the baby or fetus with the mother through the placenta. Now, yesterday I had drawn this picture. This is the embryo, this is the uterus, okay, ovary, fallopian tube. This is the fetus. Now the umbilical cord is coming here, the placenta is here. Now this the placental location can be in the anterior and the upper or posterior or lateral. In the cavity of the uterus, it can be located. But there is one specific mention I am telling you, that the placenta above the internal os, this is the internal os, this is the placenta, this is the internal os, and this is the external os. Now, this condition is known as placenta previa. Now, if the placenta is located over the internal os, then there would be many complications throughout the pregnancy. So you have to decide on, again, what happens, that sometimes it is here over the internal os, sometimes the lip, this is the internal os, the lip is here. But slowly, with growth, it might recover and it will be outside the internal os. Then you might not have any complications. But actually, as the fetus grows, the placenta mass is also growing, and that the uterus is expanding, and naturally there might be bleeding. And especially in the third trimester, as the baby is to be accommodated, the lower segment also in the later phase of pregnancy, the 1 month or left in the third trimester, then there will be sometimes bleeding. So it becomes a high risk pregnancy. Now with this, you please come see the 2 slides. And immediately today we have started earlier. By 12 you can leave, but don't just by this thing or 12:15. Don't leave early, because there is CCTV surveillance. The camera is recording my speech or whatever it is, not speech, my lectures or whatever it is, or interaction with you. It is recorded. If I am called for that the students of this batch is left early or this thing, I will be not to be answered, accountable. Are bhai, tumi dekho, dubar beshi dekho. If you want to revise any slide, you can take it and see it. If you want. And please complete your khata, because that has to be shown. I have corrected whatever is given to me. Even Abhijit sir has signed it. I signed the others which has been left over. Now, by these 2 days, by I think Monday, Abhijit sir will come. You give the khata and get it this thing, because Wednesday there won't be class. Even if you take, don't send to your mom or any friend. Don't send it, because that will go into viral, and that will be a news and this thing, and battering Santiniketan Medical College. এই বাচ্চা পাওয়া গেছে মাঠে অমুক হ্যান ত্যান, তখন কলেজটাই ডিস্টার্ব হয়ে যাবে। But I have to show you, it is not illegal, but who are making the news, who are talking nonsense in the TVs, are all illiterate, and who's taking part in the um, your and everything is people are focusing on politics. No one wants something good to happen because um, in one Onida TV, you know Onida TV, there was an ad on TV, owner's pride and neighbors क्या बोलेगा. যাই হোক, see, in at least it is a history created by Dr. Molay Pit. 6 months he built up a medical college in Tripura. I went there, and a small causeway or bridge to Konkalitala takes 1 year, 2 years. One road is just a small road in Bolpur. It's taking how many months, I don't know. And I feel proud that from 2019, the campus, I got it, I've seen it developing from its inception. When there was no electricity, there was no, just tiles are coming in, unloaded in the outside. From that period, I've been here and coming every Thursday to map the whole department. And in 90 days, this department I set up. It is not I'm talking that I did it. I don't say in that form. But I tell you that all the pains of the people who have come, worked, then you people are involved in the growth of the medical college from your estrella or your attitude, your studies, your visiting classes, lab, at least a new college in India, we have placed ourselves. You have to be proud about your alma mater. You have to. আমরা এটা গ্যাম জায়গায় পড়ছি. I went to Bhubaneswar 2 months back, I think, to take my students' MD examination. There are 2 faculties, one associate professor and one professor. We are having 3 professors. This thing, our Subramai will become our professor within. So we are having 5 persons. So please don't, and you just study. I'm not talking about this. I went off track. I'm not on off track, but telling you, you must be proud. You must, and don't break any slide, because this is very precious. Okay. Now with this beginning, I will just give you an idea, which about just the, you know, you are mature. You are seeing your books. You are seeing your tab. But it's my duty to show you when we have some good specimens, whatever it is. I must give you an idea. This is just a common thing. Now, this is what the umbilicus. This is the umbilicus. দেখতে পাচ্ছো? Okay. This is the umbilicus. And this is the placenta. This is the amnion. This is the amnion covering. And there are 2 arteries, 1 vein. Now, I'll show you anyway. Any time I'll meet you again. I'll show you a placenta, cut placenta, how it looks. Like in the book, it's illustrated. So, if you the slide is there, then you just draw 2 arteries, 1 vein, 1 amniotic, just a circle. You don't have to do shade and all. You won't have time. You label it. You write a short note, you just label it. Don't panic. And when you see the placenta, see this is the placental surface. This is the placental surface. Okay. Now this you will see in the histology with the covering, the amnion. There are 2 vessels, and in USG even, the sonologist, they give you a report that 3 vessels. Okay. Sometimes there may be anomalies. There are many anomalies, especially cord and all these anomalies. There's the placenta previa, I told you why, because this is the implantation occurs in which place, and then accordingly the fetus grows. The placenta covers the internal os, or just in the earlier stage of lady comes with a this thing 12 months, 12 weeks pregnancy, or 13 weeks, or 14 weeks, or 16 weeks. To terminate, you please do an ultrasound. Please do an ultrasound so that placenta location. When in normal cases, not only that, for pregnancies, the lady who wants to terminate, but the first pregnancy who wants to continue, or third pregnancy who wants to continue, then you have to order for an ultrasound. Now, if she comes in 12 weeks, you order for the. Have you done this thing? Few people, they come with a self, doctor, self. That's why I say one thing, any quack practitioners, I tell them SMD, self-made doctor, but MD. Okay. Now, this is the just a talk I told you. Now, whatever you see the slides there, and correlate and stay for at least seeing and viewing 22 weeks. You have to measure the crown rump length, CR length. Now, I am telling you regarding the USG. USG, I told you also there, 18 to 22 weeks you do an anomaly scan, and 12 to 14 weeks you do NT scan. Now, these you will find the defect of the any anomaly is within the fetus. It might be hydrocephalus, it might be a cleft lip, it might be your short limbs, it might be that polydactyly. Poly means 5 there, normal, but there may be 6 fingers. That is polydactyly. Now, these defects, if you find, you consult with the mother and tell, and this is the baby will be born with these defects. Then, if no, you terminate. Then you, with good preparation and blood investigation, you go for an abortion. If you are not, if you are not a gynecologist, you are a general practitioner. In the community you are practicing, okay, or any center you are practicing, or you get a job as an MBBS in any hospital or municipality or anything like that, then it is your duty to tell the person to do you do this ultrasound and this phases. Now, especially the Anganwadi workers and these people have, the government has made so many this thing, but one thing is that you have to insist that 18 to 12 weeks, actually they are like 2 ultrasound scanning is being done by the government. So they wait for their time and date. But you must be very bold and strong enough that this, you do it with your money or something like that, but you get this anomaly scan. Don't wait for the government's date or something like that. If they say, no, amra koriye nobo, if I will manage and do it, then you must. Because see, I will, I'm trying to build up a gallery here with the abnormalities. In 86, 88, there was a conference, I printed this thing, monograph, that is human congenital malformations. What are the different types of malformations and all? I think we have it in the museum, but I'll be putting it here. But the photographs and all, you will get astonished. The twins, I had collected. and anencephaly fetuses. But these things are coming rare. Practically, even if it is, if you get, of course you are getting, you will be getting. Even I've got one hydrocephalus, one anencephaly. I'll be bringing it to the college. Now, this is due to the callousness, I would say, of the doctor who's concerned. I will say it's a callousness. With these modern gadgets, otherwise ultrasound is such a tool, you can do many things. You can do many things. And it costs hardly, anomaly scan, some centers take 2,000 rupees, some centers take 1,500. That's not the matter. Because once that baby is born with an anomaly, or at later phase they come to know, the third trimester they are another doing an ultrasound, then they'll be seeing what? They'll be seeing a defect. Now that becomes a high risk of terminating. Either you have to open up, do an LUCS and get it terminated. Another methodology of, you will teach learning in gynecology, that what the methodology of termination of pregnancy. So you have a big responsibility as an MBBS. Even when you are in your internship, you are doing your gynecology 3 months. So in that period, you have to scrutiny all the time in the when you are in the clinics after your MBBS. You see it properly. That is the time, that the fertile period of acquiring knowledge, clinical knowledge. But we are having all modes of investigation. MRI is there, CTs. I'm not telling about the pregnancy, you do an MRI or a CT. Ultrasonography will do. Even if the anomaly scan, sonologist says there is some problem with the heart, he mentions. And otherwise, they write in the report that your anomaly scan, that echocardiography is not done, fetal echocardiography is not done. But I'm telling you, if you are here around or anywhere in place, you get, if there is a report on the second trimester of anomaly scan, then you just report that, do an echocardiography, fetal echocardiography. Then if they find some problem, then the patient with a say small defect, then you can make aware of the, but don't panic. Don't let the mother panic. Don't panic. You have to, this is an art of consultation. You have to develop that skill. You have to console. You have to see that no, it will be done. You go to the cardiology hospital. There are lots of centers. Your mission is there. There is this thing. And by the time you pass out, we expect that everything will be set up over here within 4 years. So please, it has nothing to do with histology, but there are many things. You cannot cut off. It cannot be encapsulated. So it is all related.